Hi students, welcome back to the next series of Medi Chit Chat, and today I am going to cover drugs kept on the obstetrics table. Please note, I'm only going to cover must know points under each drug, and let's begin. So the first group of drugs that I'm going to cover are oxytocin group of covers. Now what are these oxytocin? Oxytocin drugs, they excite uterine contractions, and under this you have oxytocin, you have ergot derivatives like methergin, and you have prostaglandins. So let's begin with oxytocin. Now students, on the table, whenever you get this drug oxytocin, you'll find it in a vial, glass vial, and usually kept on the table with brand names like pitocin, syntocinon. So it's easy for you to identify that if you see these names, the generic drug is oxytocin. Mode of administration is either via IM or IV infusion. Here the word infusion is more important. Now the examiner might ask you that where in the labor room would you find this drug? Where will it be kept? So oxytocin is always kept in the refrigerator. That is because it loses its efficacy if stored at higher temperatures. So it has to be stored between 2 to 8 degrees. So you will always find this in the refrigerator. Now coming to indications. Where all will you use this drug? Now it's used to induce labor, to augment labor, to ripen the cervix, and to overcome uterine inertia. And the most important indication that we expect from undergraduates is in active management of third stage of labor. So pitocin really helps to prevent PPH. Hence, it's used in the active management of third stage of labor. Now, where is this drug contraindicated? It's contraindicated in contracted pelvis in malpresentations. Now, what are the parameters that you will monitor if someone is under oxytocin infusion? So, you will watch for uterine hyperstimulation where there are excessive uterine contractions without relaxation between two contractions or more than 6 contractions in a 10-minute time frame. So you will watch for uterine activity whenever a woman is given oxytocin. Then also watch for hypotension. So these are few what to watch for when a female in labor is under oxytocin. So these are a few things that I want to tell, and also to watch for fetal distress. So I hope you've understood oxytocin and you'll be able to answer. Now moving on to the next one is methergin. Now methergin and ergometrin, these are ergot derivatives. Now how do they act? These group of drugs, they directly stimulate myometrium. They cause contraction of the myometrium in such a way that each successive contraction is stronger than the previous one without relaxation in between, which causes an entire uterine spasm. So, understanding the physiological action, we do not use methergin to induce labor or to augment labor. We never use it before the delivery of the baby, or at most we use it only after the anterior shoulder of the baby is delivered. Whereas if you compare it with oxytocin, oxytocin causes only contraction of the upper segment of the uterus, but methergin causes contraction of the both upper and lower segment with no relaxation in between two successive contractions. So we've understood about not using it to induce labor. So where do we use it? Methergin is an effective drug in case of atonic PPH. The spasm of the uterus, it prevents bleeding from all the sinuses. Now, how is it administered? It can be given parenterally as well as orally. It is used to Symptometrin should always be administered IM, that is intramuscular. Now, talking about indications of methergin. So you have a prophylactic indication and you have a therapeutic indication. Your prophylactic indication is in active management of third stage of labor, and your therapeutic indication is to treat atonic PPH. Contraindications of methergin is an important question that an examiner would want to ask you, And these are the few contraindications that you need to remember. It is contraindicated in cases of PIH, preeclampsia, or eclampsia due to its vasoconstrictive action. Methergine is contraindicated in a patient with heart disease. It's also contraindicated in Rh negative mother. So these are a few contraindications that I want you to remember. Methergine is not to be used in case of suspected puerile pregnancy, that is more than one baby. So if you happen to give it accidentally after the delivery of the first baby, the second one will get compromised due to tetanic contraction. So it's contraindicated. Do not give methergine during labor. Do not give it in first stage, second stage of labor. Not to be given before crowning, or preferably, till the time the baby is delivered. So these are a few things that you need to remember whenever you're answering about methergine. I hope you've understood. The last one that we're going to discuss under the group of these oxytocin drugs is prostaglandin. And under prostaglandin, I'm going to talk about two preparations. One is PGE2, called as dinoprostone, and second one is PGE1, mesoprostol. So let's start with PGE2, prostaglandin E2. On your table, you will find a long plastic syringe-like drug kept with preferably a brand name called Serviprime gel. It's nothing but a dinoprostone gel which is used for induction of the labor to ripen the cervix. The dosage is 0.5 mg or 500 microgram is to be inserted intracervically, but should not cross internal os of the cervix. It can also be instilled in the posterior fornix of the vagina. Dinoprostone gel is effective in causing cervical dilatation and effacement. It reduces the requirement of cesarean section for the delivery of the baby and allows us to give a fair trial of vaginal delivery. These gels are expensive and need to be preserved in the refrigerator. We will now compare PGE2, that is dinoprostone gel, with PGE1, that is mesoprostol. Mesoprostol is available in the tablet form, and each tablet is 200 microgram. Now, talking about the indications of mesoprostol, it is used to induce labor, it is used to prime the cervix, it is used to induce abortion, it is used in cases of atonic PPH, it is also used prophylactically to prevent PPH. Now let's talk in detail about mesoprostol. So in cases of induction of labor, mesoprostol can be given orally between 25 to 30 microgram, can be repeated every 3 to 6 hours. Mesoprostol is more effective than oxytocin as well as dinoprostone gel in causing induction of labor. However, the usage of mesoprostol for induction of labor is less as compared to dinoprostone gel or oxytocin. The reason for that is that the chances of tachysystole or hyperstimulation of the uterus is high. It causes meconium passage, it can cause fetal distress, and in some cases it can also cause uterine rupture. Mesoprostols are contraindicated in a scarred uterus, that is in patients with previous cesarean section or any uterine surgeries like myomectomy or hysterectomy. Prophylactically, when mesoprostol is used for PPH, the dosage is 600 microgram, but when you use to treat PPH, it's 800 microgram. Can be given per rectally or orally. Both are highly effective. A fun fact that mesoprostol was first introduced to treat peptic ulcer, and later on it found its indication in obstetrics.